Hello and welcome to my YouTube channel once again. Hello, I'm Pivotal Medic here, and in my last video I was sharing something on family planning. Today I want to share about diabetes. You've heard of diabetes. Diabetes, we have insipidus and mellitus. Today I want to talk about diabetes mellitus. So in case you've had a client who has the same, or maybe you experiencing the same as well, maybe I will get to share what I have today about the same, from the definition to the pathophysiology. Pathophysiology means how it happens, and then to how the signs and symptoms, how we get to diagnose the same, and how we get to manage and prevention. So make sure that you follow me, make sure that you subscribe to my channel and like all the videos in there. To start with, I want to define what diabetes is. Diabetes mellitus is an increase in your blood sugars. So there's a normal range that your blood sugars should be. So when it goes above the normal range, that's what we call diabetes mellitus. In a medical term, we call it hyperglycemia. So if your blood sugars is above the normal range, that is diabetes mellitus. That's the definition of the same. And sugars, we have what we call a sugar regulation, blood sugar regulation. We have two hormones that regulate the blood sugars. These hormones include insulin, and we have what you call glucagon. Insulin is the major hormone here, in that anytime that your blood has excess of glucose, insulin will make sure that it converts the excess of glucose to a stored form, which we refer to as glycogen. And then when you have very low blood sugars, then glucagon will break down the glycogen to form sugars through a process we call glycolysis. So to start with, you must understand, or rather you must realize, that when your blood sugars is high, that's what you call hyperglycemia or diabetes mellitus. Insulin is used to convert the excess blood sugars to a stored form. So anytime that you are lacking this insulin, it means that there will be no hormone that will convert this excess sugar. So I want you to have that in mind even as we get on to understand the same. So we have two types of diabetes mellitus. We have type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 is for the young ones. It majorly affects the young ones, while type 2 affects the elderly. Well, it can affect any, but most of the cases are found in the elderly. So type 1 is about 10%, while 90% is type 2. So to start with, I'll talk about type 1 diabetes. Type 1 diabetes, we have a cell which produces insulin. It's called the beta cells. They are in the pancreas, somewhere around the islet of Langerhans. So insulin, I told you earlier, it's an hormone that converts excess blood glucose to a stored form. Rather, it takes it to store in a layman language. So in type 1, there's no enough production of insulin, or there's no insulin at all. What happens is the cells that produces the same are destroyed. There's an autoimmune destruction of the pancreas, or rather the cells that produce insulin, which I've told you are the beta cells, making the insulin not to be available in blood. So anytime you take your normal meals and then they get digested and absorbed and taken to blood, there's no insulin to convert that excess glucose, or rather to transfer them to your cells. So you get to realize that that glucose will be left hanging around in your blood. So if you're lacking insulin, it means that there's no hormone to convert, and that what type 1 means. So type 1, ideally, there's no insulin in blood. Reason being, there's a destruction of the pancreas, or the destruction of the beta cells inside the pancreas that produce this insulin. So management is simple. These patients are lacking what? Insulin. So how do you manage them? You administer exogenous insulin. You've had several of your of patients being administered with insulin. So that probably is type 1. Again, in type 2, we can use insulin if the oral drugs doesn't work. So that's type 1. Type 2, sorry, diabetes. Type 2 diabetes is majorly found in the elderly, as I told you earlier. But in this case, the pathophysiology is totally different. One, there is what we call insulin resistance. Well, your body has enough insulin, but the cells, or rather the insulin receptors, are not sensitive to the same. So you have the insulin, but the receptors are not sensitive. That's the first mode that it happens, or rather the pathophysiology. Secondly, we have what we call insulin inefficiency. You're producing insulin, but then it is not enough for your body. For some huge bodied people, you might be having insulin, but it's not enough to convert the sugars from your blood to the cells. That's what happens. So you may get to realize that in type 2 diabetes, we use oral drugs because they have insulin here, but it's either the cells are not sensitive to the same, or it's not enough. So what do we do? We treat using oral drugs, because these oral drugs reduce the amount of glucose that is absorbed by the intestines. In this manner, if I take enough or much more glucose into my bloodstream, there are no cells that will convert the same. So what happens? I'll take a drug that will reduce the intake, or rather the absorption of glucose from the intestine, so that I'll just absorb the glucose that will be used by the cells. Because if I have any extra glucose in my blood, there are no cells, there are no hormones to convert the same. So that's why you use oral drugs. In severe cases, we can also use insulin in type 2 diabetes. You might have heard of people who use oral drugs and again are using insulin, but again that will be in type 2. So insulin is not just restricted completely for type 1. It can be used for type 2 as well. What are the symptoms? What are the symptoms of diabetes? We have what we call the triad symptoms of diabetes. Triad means three. So the first, amongst the three major actually symptoms, we have what we call polydipsia. Polydipsia means taking a lot of water. Polydipsia, or you always thirsty. You just have that urge of taking a lot of water. It's called polydipsia. So you might realize that, hey, I'm taking much water than I do in those other normal days. That is polydipsia. The second, amongst the triad, we have what you call polyphagia. Polyphagia means eating a lot. The cells are not having glucose. In as much as you have excess glucose in your blood, it's not converted to get to your cells. So your cells will still be in need or demanding enough glucose. So you'll be eating a lot. We call it polyphagia, eating a lot. And then the third amongst the triad, we have what you call polyuria. Polyuria means passing a lot of urine. That's polyuria. Passing a lot of urine. That's amongst the three major symptoms: polydipsia, polyphagia, and polyuria. Taking out a lot of urine, drinking a lot, and eating a lot. Amongst others that we have what you call glycosuria. You might be having glucose in your urine. And then we have dry mouth. You might realize that your mouth is so dry. There's no saliva in your mouth. That's a sign of diabetes. So anytime you realize that you have any of these, it's wise to go and check out whether it could be diabetes or something else. How do you diagnose diabetes? How do you diagnose? So first we do what's called random blood sugars. There's a gadget. It's called a glucometer. It measures the amount of glucose in your blood, and we do what you call random blood sugar. So if it's above 10.1, that shows that your the blood sugar is very high. Anything above 7.1 for random blood sugar, that's pre-diabetes. So you're not like that's you're not gotten to that extent of having diabetes. Just a pre, you're just at a risk. That's 7.1 and above. But 10.1 and above, it shows that your blood glucose is so high. That's random blood sugar. You can do it randomly, as the name suggests, anytime. But then we have what you call fasting blood sugar. Fasting, you must have exempted yourself from feeding for around 8 hours, and then you get to measure. That's fasting. Again, any reading above 7.1 shows that you are diabetic. For medical students, we have what we call OGTT, oral glucose tolerance test. Again, for this patient, you give them oral glucose. After 2 hours, you get to measure their glucose levels. So that's the third type that we use to diagnose the same. And the last, we have what we call HbA1c. HbA1c, or rather we call it glycated glucose. So you get to know the amount of glucose that is bound in your red blood cells. That is that down to know how your blood levels has been ranging for the last around 6 months. So any reading above 6.5% shows that you are diabetic. So after diagnosis, the next is treatment. So if you diagnose anything, you must treat the same. For type 1 diabetes, if you can remember, I said that we are lacking insulin because of the destruction of the cells that produce the same. So for this, it's just simple. You just give them exogenous insulin. You just administer insulin. That's enough for them. For type 2, we give what you call oral drugs or oral hypoglycemics. These are drugs that are used to treat diabetes in type 2. We have an example of metformin, glibenclamide, going by the brand name Nogluc. So these are just examples. But in severe cases, again, we have patients that don't respond to orals alone. So we can treat them with oral drugs and again add some insulin for them. That is type 2. But type 2, I'll advise on exercise. Much exercise is so advisable. It works out, by the way. And then you make sure that you reduce your weight. It's very possible you can reduce your weight because that's a risk factor. And then you check on the food on your meals, on the food that you take, so that you don't take a lot of carbohydrates. Those make your sugars to shoot so high. So just reduce on that. On the carbohydrate, make sure that you do exercise, reduce your weight if you can. That will be a nice progress for you. Actually, you'll get to realize that you'll have changed. And that's a risk factor. So if you reduce these factors, it means that you have a very low chance of having diabetes or complicating, because diabetes can complicate. And actually, amongst the complications of diabetes, we have what you call DKA, diabetic ketoacidosis. We have what you call HHS, hyposmolar hyperglycemic state. In this, your blood glucose reads above 34 millimoles per deciliter. It's just above that. We call it hyposmolar hyperglycemic state. And then it can also complicate to what you call a neuropathy. We have a nephropathy, and we have a retinopathy. So if diabetes is not well cured or rather treated, it can complicate to such. We also have what you call diabetic foot. You have an ulcer around your foot, it doesn't heal on any medication. That's a complication of diabetes. So if your sugars are well controlled, it will never complicate. Just control your sugars and you'll be rest assured that it will not complicate. So before I come to an end of this video, I'll talk about gestational diabetes. This is it's found in pregnant mothers, mostly at around the third trimester. It's gestational diabetes. They were previously not diabetic. Their blood sugar was so well and it was just okay within the normal range. But then after they've conceived, after they are pregnant and they've gotten to the third trimester, their blood sugar started to shoot. It could be familial. They could be having a familial history or not. But for this, it might end up or rather clear simultaneously, or they'll use oral drugs as well. So for some of them, after delivery, it just go away. Some others, it doesn't. The blood sugar remains high, and for this case, you can use oral drugs to control the same. And then lastly, we have what we call drug-induced diabetes. There's some drugs that can induce diabetes. There's some drugs that can make your blood sugars to get high. Mostly the steroids. You realize that steroids from the dexamethasone, prednisolone, if you take them for a long period of time, they can increase your blood sugars. For if you're diabetic, make sure that you don't use these drugs. Just make sure that you refrain from the same, because they can increase your blood sugars. How do you prevent diabetes? So they're not very I'll talk about ways which you can get to prevent the same. But then if it's familiar, it's a little bit unfortunate that it might get to you. But then I'll talk about the risk factors of acquiring, or rather having diabetes. So huge weight, or we call it huge bodies. Yes. So if you reduce your body weight, you are reducing the risk factor of having diabetes. Don't take junk foods, a lot of carbohydrates, a lot of sugars. You're reducing the risk factor. That's a risk factor also of getting diabetes. And then make sure that you do as much exercise as you can, and that will be helpful. That's for type 2. For type 1, autoimmune, it's autoimmune destruction. So there's not much we can do about the same for type 1 diabetes, but for type 2, we can do what I just said. So that's what I had briefly on diabetes. In case you have any question, again, make sure that you ask the same on the comment section, and I'll be very grateful to answer. Otherwise, thank you for your time. Bye bye. This is Abivated Medic, and ensure that you subscribe to this channel and hit that notification bell. Bye bye. Thank you so much.